It's indeed a privilege to present my topic of robotic surgery program in Pakistan. The few facts about robotic surgery in Pakistan and wherever the patients are, they may be in Pakistan or maybe in some other part of the country, they deserve to be treated with the latest treatment techniques. We still are suffering from the conventional mindset, and that conventional mindset does goes to the surgeons and to the government officials, and as a result we have not progressed in the technology. There is no actual training setup of robotic surgeons in Pakistan where they can enhance their skills. Most of the patients who are really affording and who can afford to have robotic surgery, they practically go outside the country to avail this facility, and as a result this facility is not growing, and we are draining our human resource and expertise in other countries. Robotic surgery is a trend setter, and it is a paradigm shift in the surgical practice. If we look at the robotic surgery, so we actually can control the robot and instruments by sitting in a robotic console, and as a result there is dexterity of the movement, and we can actually go through the various surgical techniques with extreme precision. In the last 10 years it has influenced the technique, and it has practically changed every aspect of surgery. It is right from gastrointestinal surgery, urology, gynecology, and thoracic surgery. If we talk of statistics in Southeast Asia, in 2012, India had 7 robots from Intuitive Surgical, Pakistan had 1 robot from Intuitive Surgical. In 2018, India had 70 robots from Intuitive Surgical, and Pakistan had only 1 robot from Intuitive Surgical. As a matter of fact, Intuitive Surgical banned commercial sale of Da Vinci robotic products in Pakistan, and that is mostly because of inappropriate utilization of the existing system, lack of funding on part of the institution and on part of the government, and inadequate use of consumables. And obviously, whenever these are breached, the service contract is breached, and ultimately they have cancelled their products to be sold to Pakistan. In 2021, India had 140 robots which are from Intuitive and CMR Surgical, and Pakistan had only 1 robot from Intuitive Surgical. As a matter of fact, in late 2021, now Sindh Institute of Urology has bought few other CMR robots, and they have developed their robotic surgery training program, and that is probably one of the milestone, and this would ultimately change the value and change the robotic surgery program in Pakistan. There are problems while we look at robotic surgery programs, and these are the high cost. Our more and more surgeons, they have actually left the country, and as a result of scarce facilities, that is a brain drain which we are actually suffering from. Most of the people are not definite about their career path, and when there is no clear career path, so actually this is one of the demotivating factor also. Training centers are not there now. The SIUT has developed one training center in Karachi, and I hope this would add value addition to this program. There is no mentorship and there is no research activity, and such things do not progress unless there are research activities. And to encompass all the there should be a robust health policy which we are actually lacking. If we really look at the laparoscopic versus robotic surgery, laparoscopic surgery has a two-dimensional view, while robotic surgery a 3D view surgical field. We do know a lot that there is absence of sense of touch, but robotic surgery have tactile feedback and that is executed through various sensors. Camera control is in assistant hands in laparoscopic surgery, while the instruments and camera all are controlled by the surgeon by sitting in the surgeon's console. It's a very difficult ergonomic position for surgeon while operating in on laparoscopic surgery. While this is the best ergonomical position for a surgeon to sit in a console and to operate through the various sensors. There are high chances of port side trauma in laparoscopic surgery where there is a limited port side trauma due because of the sensors and because of having a tactile feedback. Limited port side trauma do happens. In laparoscopic surgery, there is a problem of lack of angulation and wristed movement of the instruments are not there. However, they are all present in robotic surgery. Precision and dexterity is missing in laparoscopic surgery, but it is in robotic surgery. It is with a higher degree of precision and dexterity. Laparoscopic surgery does have a long learning curve. We have actually to suffer, we have actually to move through various components of laparoscopic surgery before achieving the mastery. However, in robotic surgery, there is a short learning curve. Uh, when we're talking of small and deeper cavities like in thoracic cavities or under the pelvis or under the diaphragm, the laparoscopic surgery does have a problem and it has a limitation in reaching these cavity. However, in robotic surgery and in all oncological surgery where a deep seated lesions and deep seated cavities are there, we can actually move through the robotic surgery. There is wide therapeutic range in general surgery and it goes through from cholecystectomy to inguinal hernia repairs to ventral hernia repairs, hiatal hernia repairs, Whipple procedures and splenectomies and hepatic resection. So these are the wide range of operations which can be executed through the robotic surgery. We're talking of colorectal and upper GI procedures right from esophagectomies to lap halus to gastrectomies and lower GI procedure lap LAR to APR, right hemi, left hemi, transcolectomy. So these are the wide range of the procedures which if done laparoscopically probably does have a lot of difficulties and it can be safely executed through robotic surgery program. Bariatric surgery is again one of the very important paradigm and robotic surgery helps a lot in doing sleeve gastrectomy, gastric bypass, mini gastric bypass with great degree of ease. Gynecology is again on all the gynecological organs or they are present in the ovaries and we can actually execute the various procedures like hysterectomy, radical hysterectomies, myomectomies, endometriotic cyst excisions, ovarian cystectomy and salpingo-oophorectomy through robotic surgery and with the help of extreme precision and dexterity. Talking of urology, it's coming from nephrectomy to partial nephrectomy to radical prostatectomy, pyeloplasty, ureteroureterostomy, adrenalectomies, nephroureterectomy, and ureteric reimplantation and cystoprostatectomy. So these are the wide range of urology procedures which can actually be executed through robotic surgery. Looking at thoracic surgery program, transthoracic esophagectomy, pulmonary lobectomy, mediastinal mass resection, and thymectomies, which are actually done with the difficult ergonomic position and not handled by the even by the experienced surgeons. They can be handled easily with the robotic surgery program. So there are a few initiatives which are meant to be taken by the government in order to develop the robotic surgery in Pakistan, and these programs can only run if there is allocation of budget on behalf of the universities and on behalf of governments for the latest technology. We have to create a program where trainees should have a safe learning skills and refinement of skills are there, and these can only be executed if we have a cadaveric labs for robotic and MIS, when we have a mechanical trainer, VR trainers are there, so that actually these skills can be learned in a simulated environment, and we are actually safe to the patients while we operate on the patients through these highly advanced surgeries. College of Physician and Surgeon can help a lot in including a compulsory rotation for a couple of months for robotic surgery, and as a result, the various postgraduates can rotate through various programs. And by all means, funds have to be ensured that they can be utilized for robotic surgery so as to improve an image of our country in international market. Talking of impact of robotic surgery in Pakistan, so internationally, whenever our surgeons do apply for a job, so now more and more robotic surgeries are going throughout the world, and if our surgeons are competent in robotic surgery, so they can actually apply and seek their jobs abroad, and as a result they would be a source of great foreign exchange to our country. A few of the various important awareness programs have been launched just late in 2021, and these were the webinars which have been arranged for general surgeon, urology, and gynecologist, and this was at the forum of SIU2 in collaboration with Dow University of Health Sciences, and they have actually inculcated a great amount of knowledge and awareness among the surgeon about the role of robotic surgery in Pakistan. So this was on the second awareness program which has been launched in 2021, Dow University of Health Sciences, and it has created again a great amount of awareness and conducted in August 12, 2021. So this is all about robotic surgery, and actually we have tried a lot to take this robotic surgery in Pakistan in public sector, but inshallah it would start soon in the private sector. We have almost went through all the procedure codes, and we have done our agreement with the CMR Surgical, and I hope inshallah with the help of expertise at National Hospital, and it is with the great efforts of National Hospital that we would be able to start our robotic surgery program in Pakistan inshallah in March or April. Thank you very much.